Welcome to Nursing School.
Welcome to Nursing School.
Welcome to Nursing School.
Question. 1. The three layers of the skin include all except the A. Epidermis, B. Dermis, C. Subcutaneous, D. Subdermis. Correct answer is D. 2. List 3 physiological changes of the skin related to aging. Answer is 1. Wrinkles and fine lines. As we age, the production of collagen and elastin, proteins that provide skin structure and elasticity, decreases. 2. Loss of moisture and oil. Aging skin tends to become drier because oil production decreases and the skin's ability to retain moisture diminishes. 3. Thinning of the skin. The outer layer of the skin, epidermis, becomes thinner with age, which makes it more prone to damage and slower to heal. 3. Pressure ulcers are usually located over bony prominences. Damage of underlying tissue. A. True. B. False. Correct answer is A. True. 4. Initial assessment of a pressure ulcer must include A. The location, the size, length x width x depth, the stage. B. Sinus tracts, undermining, tunneling, exudate. C. Necrotic tissue, presence of absence of granulation tissue, epithelialization. D. All of the above. Correct answer is D. All above. 4. List 3 risk factors for developing a pressure ulcer. Answer is immobility, poor circulation, urinary incontinence and sensory impairment. 3 common risk factors for developing a pressure ulcer. Ulcer, also as a pressure sore or bedsore, include 1. Immobility. Patients who are unable to change their position regularly are at higher risk because constant pressure on certain areas of the body can lead to tissue damage. 2. Poor circulation. Conditions that affect blood flow, such as diabetes or cardiovascular disease, can impair the delivery of oxygen and nutrients to tissues, making them more susceptible to damage. 3. Sensory impairment. Individuals with neurological disorders or spinal cord injuries may have reduced sensation, which means they may not feel discomfort or pain from prolonged pressure, leading to prolonged tissue compression and injury. These factors contribute to the development of pressure ulcers by increasing the vulnerability of the skin and underlying tissues to damage from pressure and shear forces. Forces. 6. Low air loss and air fluidized beds are only indicated for residents with stage 3 or stage 4 pressure ulcers. A. True. B. False. Correct answer is B. False. 7. A pressure ulcer that is superficial and presents as a blister with partial thickness skin loss involving epidermis and dermis is graded as A stage 1. B stage 2. C stage 3. D stage 4. Correct answer is B stage 2. 8. A stage 1 pressure ulcer will present with A. Warmth and edema. B. Induration or hardness, C. Non-blanchable erythema. D. Discoloration of the skin. E. All of the above. Above. Correct answer is E. All above. 9. While sitting in a wheelchair, the resident should be encouraged to change position or shift his/her weight at least every A. Every 30 minutes. B. Every 1 hour. C. Every 45 minutes. D. Every 2 hours. Correct answer is B. Every 1 hours. 10. When floating heels off of the mattress, the heels should be raised. A. Enough for your hand to fit between the bed and the heels. B. 2 inches off of the bed. C. Just enough for a piece of paper to pass between the bed and the heels. D. At least 1 inch off the bed. Correct answer is C. 11. Donut-type devices are the recommended positioning device for residents at risk for development of pressure ulcers. A. True. B. False. Correct answer is B. False. 12. List 3 preventative measures to take when a resident is at risk for developing pressure ulcers. Correct answer is 1. Regular repositioning. Encourage and assist the resident to change positions frequently, ideally every 2 hours if they are immobile or have limited mobility. 2. Skincare. Maintain good skin hygiene by keeping the skin clean and dry. Use mild cleansers and moisturizers to prevent dryness and protect the skin's barrier function. 3. Use of support surfaces. Provide appropriate support surfaces such as pressure-relieving mattresses, overlays, or cushions. 13. What is the most severe type of pressure ulcer? A. Stage 3, B. Stage 1, C. Stage 4, D. Stage 2. Correct answer is C. Stage 4. 14. A pressure ulcer that presents as a deep crater with or without undermining adjacent tissue is A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Correct answer is C. Stage 3. 15. The intact skin surrounding a pressure ulcer is called A. Wound bed. B. Peri-ulcer. C. Subdermis. D. Abscess. Correct answer is B. Peri-ulcer. Peri-ulcer refers to the area around the ulcer itself that is still intact and unaffected by the ulceration. 16. Which type, S, of dressing requires the least amount, S, of time? A. Wet to dry dressing. B. Hydrocolloid dressing. C. Film dressing. D. Both B and C. Correct answer is D. Both B and C. 17. Which of the following vitamins is needed for collagen synthesis, capillary formation, and resistance to infection? A. Vitamin A, B. Vitamin B, C. Vitamin C. D. Vitamin K. Correct answer is D. Vitamin K18. A patient's pressure ulcer is superficial and presents clinically as an abrasion, blister, or shallow crater. It would be categorized as which of the following stages? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Correct answer is A. Stage 1. 19. Which of the following patients would be at greatest risk for developing a pressure ulcer? A. Newborn. B. A patient with cardiovascular disease. C. An older patient with arthritis. D. A critical care patient. E. A critical care patient. 22. Which of the following patients would most likely develop a pressure ulcer from shearing forces? A. A patient sitting in a chair who slides down. B. A patient who lifts himself up on his elbows. C. A patient who lies on wrinkled sheets. D. A patient who must remain on his back for long periods of time. Correct answer is D. A patient who must remain on his back for long periods of time. 23. A large wound with considerable tissue loss allowed to heal naturally by formation of granulation tissue would be classified as which of the following categories of wound healing? A. Primary intention. B. Secondary intention. C. Tertiary intention. D. None of the above. Correct answer is B. Secondary intention. Intention. 24. Briefly describe the phases of wound healing. A. Hemostasis. B. Inflammatory phase. C. Proliferative phase. D. Maturation phase. Answer is A. Hemostasis. This phase begins immediately after injury and involves the cessation of bleeding. Platelets aggregate at the site of injury to form a temporary clot, and vasoconstriction occurs to minimize blood loss. B. Inflammatory phase. Inflammation sets in within hours to days after injury. White blood cells, primarily neutrophils and macrophages, migrate to the wound site to remove debris, pathogens, and damaged tissue. This phase also involves the release of various chemical signals that initiate and coordinate the healing process. C. Proliferative phase. During this phase, which typically begins around day 4 and can last up to 3 weeks post-injury, the wound begins to be rebuilt with new tissue. Fibroblasts produce collagen, which forms a matrix for new tissue growth. New blood vessels form, angiogenesis, and epithelial cells migrate across the wound surface to form a new epidermis. Granulation tissue, which is rich in blood vessels and collagen, fills the wound bed. Dematuration phase, also known as the remodeling phase, this final phase can last for months to years. During this time, the collagen fibers reorganize and remodel to increase the tensile strength of the new tissue. The wound undergoes contraction, reducing its size. The scar tissue matures and becomes less red, raised, and firm, although it may never regain the full strength of the original tissue. Each phase is essential for successful wound healing and involves complex interactions between cells, cytokines, growth factors, and the extracellular matrix. 25. Describe the RYB color classification and care of open wounds. AR, red protect, BY, yellow cleanse, CB, black debride.